Welcome to CareTalk, America's home for incisive debate about healthcare business and policy. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. David, the baby formula shortage, what is causing it?
Well, John, it would have to be a pretty big topic for us to start talking about babies and baby formula, because at least for me, it's been a while since I've dealt with that. But
it's been a long while since you've dealt with it.
It is, John. But seriously, this is a major crisis that has implications for healthcare and social policy. And really, we need to talk about what is causing the baby formula shortage. And John, before we get to that, I want to ask you an even more basic question. Is there a baby formula shortage?
Well, yes, there is. I think that's kind of obvious, David. A year ago, the stockouts or when you run out of baby formula in the stores were about 2 to 8% per month. This month it was at 43% of stores that stock baby formula running out at times, and last month it was 30%. So if that isn't a shortage, I don't know what is.
Well, John, I think you actually do have to compare this with, for example, the shortage of COVID tests. When those came out, you're talking about.
Are you arguing that there is not a baby formula shortage?
I'm saying I think there is a shortage. I think the answer is yes. However, it's not as severe as what the shortage was of the COVID test, which instead of a 43% out of stock rate, were more like 90 or 95%. And then the other curious thing, John, is that there supposedly more baby formula shipped in April than there was in January, which is the month before the Abbott plant actually had a recall and closed down. And so it's possible that some of this just has to do with like where the stock is, whether people are actually hoarding it at home or not. So there's a shortage, there's a problem. Unclear exactly how severe.
Now you're going to admit that there's a shortage. I mean, David, we've had supply chain problems throughout the pandemic, and some of the key components that come from abroad and domestically were slowed down. We've had transportation shortages. We've had this, there's a fairly concentrated industry that makes baby formula. Abbott with the Sturgis plant that makes about half of its formula shut down by the FDA because of a fear of contamination. You've got Reckitt Benheiser, you've got, but it's only like 4 or 5 players, with 2 or 3 having 30 to 40% share. That's concentration. And then when you have added to a tight supply chain, the shutdown of a plant, I think we have a problem that we really have to jump on and manage. And I don't think, you may be far away from it, but all of us, anyone who's been a parent, recognizes that any moment when your vulnerable infant is perceived to be under any threat, or it creates terror. So I think that that we ought to dig into this and tell people and share with people how the country is going to dig out of it, because it's terrifying for these young families.
Absolutely, John. And you mentioned, of course, the supply chain issues, which are across the economy, and there are some additional factors here, I think, as you're alluding to. So with a concentrated industry, it means that if the biggest player has a shutdown of half of its capacity, which they had in Michigan, then that's going to take something like 20% offline. And there are reasons why it's hard to actually make the shift. Now, in addition to those general supply chain issues, which the formula industry also faces, there's a lot of bureaucracy. So there's some tariffs, that are on importation of baby food. There's also labeling issues that make it really hard to import. The former president actually put trade restrictions on Canada in sort of getting rid of NAFTA that made it hard. So those things are happening. One thing that was interesting also was that the federal government, through the Women, Infant, and Children's Program, is the main buyer of formula. And the way it's administered means that states tend to...
Well, that's because, just to kind of give people context, 65% of the formula in America is going to that low-income food support program that's called WIC, or Women, Infants, and Children, because the majority of babies are born in low-income families, and this provides kind of critical food support.
John, we talk a lot about the the older folks, Social Security, Medicare. That's where a lot of the funds go, and as a result, actually, we have a very high rate of child poverty in the U.S. So, we're 38th out of 40 in the OECD countries as it relates to child poverty. So when the states are now essentially buying formula for these moms, for these families, they will award a monopoly in their state to a particular formula maker, and they get big rebates, big discounts as a result of that. And then the moms use vouchers to purchase the selected brand. Usually that works out okay. The states get a good deal. The manufacturer's okay with it because then they get big shelf space in the state, and that gets the retail customers there as well. When you have a situation like this and you've got your voucher and it's good for one brand, that's a problem.
Well, I think that the thing to remember is, in the same way that supply chains were thinned out because of rational economics on the private sector side, purchasing thinned out supply on the public sector side. And I think that post-pandemic, we've got to really revisit whether the base economic model of having no extra supply or redundancy in the supply chain for critical areas like food and drugs makes any sense at all, and whether the same challenge in a different form, relying on a very small number of providers, is the right solution for government. I mean, we have to kind of have, I think, a different view of not just the supply chain, but the supply in the supply chain if we're going to solve this. But as of right now, David, what's your critical list of what we should be doing right now to solve this problem, which is scaring people?
It is a problem, John. I will give you my answer, but I think that one of the challenges here also is that the country's become so politicized that people are using this very emotional and serious issue to double down on whatever their main point is. So you'll see some that say, hey, we shouldn't have FDA regulations. Look what the bureaucrats are doing. Or, hey, we shouldn't give, so much of the, poor people shouldn't be getting stuff for free. Or that so-called, illegals at the border are taking all of the. I
mean, that's got to be the dumbest thing we've heard. That somehow we're going to let babies starve. I mean, they're forget about the citizenship status of those children. They're children, and then infants, completely vulnerable. I mean, that's the most insane things that's coming out of Texas Governor Abbott and Fox News. But there are some very specific things. Yeah. There's that walloping 16.75% tariff that President Trump whacked on a lot of infant formulas that were coming abroad. There are the excessive labeling requirements that the FDA has for formula that's effectively the same chemical compounds coming from Europe. You've got, I think, at least an argument that that the FDA's requirements around reopening that Sturgis plant, where a lot of the supply could be, need to be accelerated. And I think that's what Senator Romney was poking at. But what's interesting is we're not going to solve we need to solve the economic structure of redundant and supply around critical food and medicine. But right now, and it's not a Democratic or a Republican policy, it's really how do we make government react faster and more effectively in a moment of crisis? Because we know that it's not like these infants are exclusively eating formula. Right. So you can't just ration it. That runs the risk of permanent physical and mental damage. You can't dilute it. You could switch brands, I guess. That would be possible if you can find it. And it's very hard, if not impossible, for most of these infants to move to solids. And only 25% of moms breastfeed. So, David, I think this is a moment when government's got to react, and government's got to react fast.
So there are, in addition to what you indicated, there is a possibility for some of the, older babies to move to, whole milk is also a possibility. But if you think about what's happening, can happen faster and is starting to happen, is to be able to do some importation, because the products that are on the market in Europe, in particular, are they have the same level of standards.
They're effectively identical. Yeah, they're effectively identical.
Yeah, so I think that is the case here as well. So and I think you're right about probably reopening that Sturgis plant too. Although we're not the experts on what the contamination is like, and maybe they found other reasons to keep it closed. I do want to mention that one thing that I hope does not happen as a result of this crisis is that the FDA, is forced to relax its policies. And I want to bring up a couple things. I know that, as of a couple of years ago, I knew people who were going to visit family in China, and they would pack up tons of baby formula and bring it over there because people didn't trust the government's oversight of the formula market in China. They didn't trust the individual manufacturers, and who could fault them. And so it's good that we have these standards. And even this goes way back, John. If you go to Boston Children's Hospital, you'll see these pictures from the olden days, and they show cows actually in front of the hospital. And everybody thinks, well, this must have been so such a rural area had cows. No, what happened actually, there was adulterated milk in Boston and other places, and Children's had its own cows so they could ensure that the supply was pure. So, we talk about the Pure Food and Drug Act that established the FDA. We don't actually want to lose.
I'm enjoying this travel down memory lane, but what else can we do now?
So there's, one thing is to say, well, there are other manufacturers. Why don't they ramp up? Now, one of the things about this industry is that it's one that doesn't have a lot of seasonal demand, right? The babies have the same amount pretty much every day. It's not like there's a Christmas season or something where you're making a lot of one item. It's not a seasonal item. And so they don't tend to keep that much spare capacity. Now, a couple of the other manufacturers have actually ramped up they're going 7 days a week, 24 hours a day. So that is happening as well. And another thing that's happening is you're taking some of the market for Ensure and actually creating liquid formula for babies, because that's one thing that you can transition pretty quickly. You can air freight the product from Ireland.
Ensure, and I mean, not everybody is in the same demographic as you are, David.
No.
Ensure is a protein supplement for people who are older,
who get most of their energy from drugs, whether illicit
so
or
you
illicit.
can reformulate it for
because
but I think that all of that this needs to be a kind of all of the agenda items options. I mean, we should be moving on this very quickly. And I think one of the things that I don't think that President Biden gets credit for, but has actually done a pretty good job with both getting the country vaccinated, getting tests in, getting PPE and supply chains sorted out with regard to the pandemic. Sure, the pandemic's not finished with us, but we are prepared, better prepared than ever, the Paxlovid drugs. And now he's shown that we can actually turn up the supply chain and maybe even turn the war in the Ukraine. Let's hope we see the same kind of leadership, creativity, and focus on this terrifying shortage. And I hear you that you can still find it. And it's, I think, good news that retailers like Target, CVS, and Walgreens are limiting purchases to, I think, 3 items per visit. Because I think that one of the unfortunate systematic behavioral things is whenever there's a fear of a crisis, there's hoarding, and there's obviously people price gouging. But this is a moment where I think the federal government can shine and lead if they choose to. But it's going to require some. I think it is going to require pushing the bureaucracy, because the FDA. Outside of vaccines has not historically set indoor speed records at a kind of approving things.
That's for sure, John. And I think that this increasing the flexibility on the WIC program so that the vouchers can be used for multiple brands, I think is an important thing. That's hard to do. The bureaucracy is not set up to move that fast, but that's something where you want to take as an emergency measure. And then I would say then longer term, we need to look at things like avoiding single sourcing and keeping buffers and basically paying more for resiliency. Now, that's not something that's going to help anybody tomorrow, but it is something to consider longer term. And I really doubt that this will have any impact.
It's true across all of healthcare. It's not just true of formula.
John, there's a tremendous shortage of contrast agent that's used for CAT scans for GE equipment. And there's a single factory in Shanghai that is where GE makes all this product. And it means that oncologists are being told that they have to basically limit the scans. It's affecting people who have cancer right now. So we should learn something, from the pandemic and not put all of our eggs in one basket, so to speak. But I also encourage people not to play politics with this. It's not because of illegal aliens that there's a formula crisis. It doesn't make sense to take money from the Ukraine aid to provide it for formula. Let's be humane about what we're doing here. Well, good job.
We got the tools to solve this problem. Let's get to it.
I agree, John. Well, that's it for yet another edition of CareTalk. We've been talking about the baby formula shortage and what's causing it, what can be done about it. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. If you liked what you heard or you didn't, please subscribe on your favorite service.